All right, guys, last question.
Right there.
Thank you. A question for you and then a question for the doctors on childcare.
Sure.
On the campaign, it really does sound, though, like you're saying, do as we say, not as we do. You're telling people to listen to local officials, but in Tulsa, you defied local health officials to have an event that, even though you say it didn't result in a spike, dozens of Secret Service agents, dozens of campaign staffers are now quarantined after positive tests. And then in Arizona, one of the hardest hit states, you packed a church with young people who weren't wearing masks. So how can you say that the campaign is not part of the problem that Dr. Fauci laid out?
Well, I want to remind you again that the freedom of speech and the right to peaceably assemble is enshrined in the Constitution of the United States. And even in a health crisis, the American people don't forfeit our constitutional rights. And working with state officials, as we did in Oklahoma and as we did in Arizona, we're creating settings where people can choose to participate in the political process. And we'll continue to do that. I think it's really important that we recognize how important freedom and personal responsibility are to this entire equation. But allowing younger Americans to understand, particularly in the counties that are most impacted, the unique challenges that we're facing in their age group, we think is important. But look, it's so important that we recognize that as we issued guidance to reopen America now 2 months ago, and now as all 50 states are opening up our country again, people are going back to work, American everyday life is being restored kind of one step, one day at a time. I think it's important that we remind ourselves this is not a choice between the health of the American people and a strong economy. There are profound health implications to the lockdowns through which we just passed. I heard a statistic not long ago at a task force briefing that in one jurisdiction there'd been a 50% increase in the number of people presenting at emergency rooms having attempted suicide. I mean, there are profound mental health issues. There are profound economic issues, people needing to be back to work. And so our objective here today is just to make sure the American people know in 34 states, the cases are largely stable, and there's no combination of rising cases and rising positivity rates. That's a tribute to the American people. And in the 16 states we're focused on today, we simply want to equip particularly young people with the knowledge of the part that they can play in stemming the rising tide of new cases. Not because the coronavirus represents a significant threat to them. In most cases, it doesn't if you're a younger American, but because no younger American would ever want to spread the coronavirus to someone who would have a serious outcome. But I'm grateful for the time today. We hope this has been helpful. And we'll be back with more information as time goes on. Thank you.
Well, good morning out west, good afternoon in the east. I am Chuck Todd, and you've been the Coronavirus Task Force, members of the task force, just wrapped up their first briefing in nearly 2 months. Took a handful of questions, clearly not satisfying that press corps that was in there. A lot more arms and hands and shouts went up there. They did only take a few questions. Vice President Pence, who led the briefing, attempted to downplay the news surge multiple times, and he dodged a question about whether people should wear masks.
I spoke to the governor of Florida, of Arizona, of Texas, just within the last 12 hours. And I told them that from this podium today, we would remind their citizens to heed the guidance and the direction of state and local officials. We just believe that what's most important here is that people listen to the leadership in their state and the leadership in their local community and adhere to that guidance, whether that have to do with facial coverings, whether it have to do with the size of gatherings.
Any way to avoid that M-word mask. Briefings were largely suspended about 2 months ago. NBC News reports that the task force has been pushing to resume briefings for some time now, but faced pushback from the White House. Now, today's briefing comes as the stock market plunges in the faces of a new spike in COVID-19 cases, driving the numbers back to where they were at the peak of this crisis and forcing Texas and Florida to begin pulling back and shutting down again. That seemed to trigger the market when Texas announced its bar closure. For more on the case numbers, my co-anchor for the next hour and 7 minutes now, Katie Tur. Katie, a good afternoon to you.
And Chuck, the United States, let's get into some of the numbers, now has more than 2.4 million cases of COVID-19. More than 125,000 people have died. Florida once again set a record high number of new cases with nearly 9,000 reported. The state has seen an increase of over 33,000 cases in the past week. And now Florida is suspending drinking alcohol at bars. Today, Texas Governor Greg Abbott announced his plan to halt his state's reopening process as a result of the new spike. Effective this hour, bars will be closing and restaurants will be capped at half capacity. So, Chuck, I know we just heard a lot of a rosy picture of what's happening. That's the nicest way to put this in this country right now, talking about how not all of the states are doing badly. It's only some pockets. But the reality is Houston, and you can ask our reporters on the ground, Houston's hospital system is at capacity. There was a doctor on at 12 o'clock today saying that he has to tell family members of patients in the hospital suffering from COVID-19 that he doesn't have a bed for them, that they have to wait in the ER and then get transferred to another hospital. He says families can't understand what is going on there. They're seeing what happened here in New York, and I know at the beginning of this, we kept saying over and over again, New York is your future. This is what is going to happen to your city and your state. Just wait. Take the advice that we are giving you. Look at what's happening here and make sure it doesn't happen in your state or your city. And we're not seeing that in places like Houston. We're not seeing that in places like Florida. We are seeing hospital capacity go down. We are seeing the rate of cases spike. And what we just had there from the coronavirus task force, besides Fauci, was a lot of wishful thinking on how good things are right now, talking about contact tracing, planning for it. We still don't have contact tracing. Talking about taking precautions. Vice President Pence not saying the word mask once. I had a conversation with an HHS official while this was happening. Why won't the vice president say the word mask? And they gave me every answer, but an answer that gave me any explanation. I asked if the president would get mad if he said mask. After all, he wasn't wearing a mask. And this person just said, I don't know. Let's go to the White House. President Trump was not at today's task force briefing, and NBC News has learned that the president canceled his planned trip to New Jersey this weekend. So let's bring in NBC's Monica Alba at the White House. So, Monica, why was the president not at this briefing?
It's a great question, Katie, and I think the location, as much of the content, is notable here. You had this first briefing in nearly 2 months from this group at the Health and Human Services Department, and that was by design. You remember at the beginning of these briefings, they didn't normally include the president. You had Vice President Pence and other members briefing the public, and then only a couple of weeks into the pandemic, the president decided he wanted to be in these briefings and he wanted to be the one speaking and taking questions, and it became rapidly apparent that on medical issues and health advice, the president wasn't the best person to take on those questions. So the task force then decided to stop the once near daily briefings and decide to pivot to a different strategy. And so since then, you really haven't had the president as much getting into these situations where sometimes he's confronted with questions he frankly either doesn't have the data to answer the question to or doesn't know how to answer. So you saw today Vice President Mike Pence, though, really echoing some things we've heard from the president, and that includes what you point out on face masks. You had people asking the vice president directly, why not encourage Americans to wear one? He literally went through all of the other CDC guidelines he wants people to be enforcing, but did not include the very important one about face coverings. And I thought it was notable that both he and Drs. Burks, Fauci, and Secretary Azar all did walk out there with face masks on. The vice president removed his to speak, but then did not put it back on. And that's because we haven't seen the president wear one in public. He only wore one once briefly behind the scenes. And something else that stood out here, you had reporters pressing the vice president on why the Trump campaign continues to hold these large-scale political events like you had in Tulsa with no social distancing and limited face coverings. And he said it was simply because of freedom of speech and freedom to peacefully assemble, and said you can expect more of those indoor gatherings to come in the future, not to decline. That really stood out to me, Katie.
He was saying follow the guidelines from your local and state officials, and he was asked, well, why are you not following the guidelines from those areas like in Tulsa or in Arizona? And he said freedom of speech and the right to peacefully congregate is enshrined in the Constitution. Monica Alba at the White House for us. Monica, thank you very much. And after